Hi, Dr. Henry. I hear you talking about people should think about the way that they were thinking earlier this year when it comes to the pandemic. And it sounds like you are reluctant to go back into a lockdown situation. I'm wondering why that is, and given these high case numbers this weekend, how close we may be to extending the restrictions that are in place now and perhaps even bringing in more.
Yeah, so the difference between what we were thinking about in April and what we know now are we know that there are many things that can continue to happen safely. We know we can safely go to schools. We haven't had outbreaks related to restaurants when the rules are followed. Small groups, keeping our distance, wearing masks, the closing hours, we adjusted the hours because we found later in the evening when people were more drinking, less eating, they tended to flout the rules. So we took measures to put things in place that made those environments safe. Things like hair salons and nail salons and barber shops, when the rules are followed and when people are following the COVID safety plans, wearing masks, having limited numbers of people, having gaps between people, we're not seeing transmission of this virus. So we're in a much different place than we were in April. But in some ways, we need to be thinking the same vibe as we were in April. And that means thinking about our social gatherings. It's when we're coming together, particularly now, we've learned that this virus spreads quite easily in the colder weather. It spreads indoors. So when we're coming together with people indoors and not keeping our distance, not wearing masks, in those social connections, those social settings, whether it's in our home or whether it's in the lunchroom at work or carpooling to work or talking with the other parents at the indoor volleyball game that our kids are playing, those are settings now that we're seeing transmission. So in terms of our social connections, we need to start shrinking back to our pandemic bubble, keeping our family close, having our close contact with our family, but not having those unsafe connections with larger numbers of people, whether it's in our home, whether it's at an athletic club, whether it's in an environment in the community. So that's what I meant by needing to go back, needing to refocus our social interactions so we can keep those really important things in our community, like our surgery restart, like our schools, continuing to function.
Yes, a little more detail on Christmas bubbles and who we have over to our homes. Is it strictly just who already lives in your home, or if your Safe 6 involves other family members who might live in a different household, can they come and visit at Christmas?
I don't know the answer to that yet. What we're telling people right now, and this is because of what we're seeing right now, is if you're in the Fraser Health, Lower Mainland, Vancouver Coastal Health region, you need to stick to your household bubble only. This is thinking back to where we were in April. Those people who are our close contacts, our close household. And, we put out some definition of household because it's different for different people. It's who our family is, and that may be people that we're related to, it may be people that we are close to. So if people living alone, they may have one or two other people that are in their pandemic bubble. And thinking back to what we were thinking about in April. For some families that may, who have children who live with both parents, that may be two families. Right now, that is the focus. In the rest of the province, we're starting to see increased transmission in our community. And we're saying you need, and there's an order about this, you need to stick to your Safe 6. So your household plus those one set of 6 people maximum that your family is connecting with. But right now, we need to think about reducing all of our social gatherings. If it's not necessary to visit, don't do it right now. Give it a break. Let us get the numbers down. And it's most important in those areas where we're seeing a lot of community transmission, but this is spreading around our province, and we now know that the season makes it easier for this virus to spread. So all of us need to think about no gatherings, supporting our families and our friends in remote ways, in ways that are safe.